board member of Zagazig Derma and DMC. No conflict of interest. We know that botulinum toxin is a neurotoxin which is produced by the gram-positive anaerobic botulinum toxins. The efficacy of botulinum toxin is treating hyperhidrosis, and the glabellar line is well established and FDA approved, either the axilla, the palmar, and the blunt. But also we know that in 2002, there is moderate to severe glabellar lines FDA approved. In 2004 in axillary hyperhidrosis, in 2017 for headlines, and finally in 2013 Krauss feet FDA approval. But we should know that botulinum toxins also inhibit the acetylcholines and other neurotransmitters as norepinephrine and substance P, so can be used in other dermatological disease. We have 5 categories can be treating, but all of these are off-label use. First is sweating-related disorders. Second, pain and itching disorders. Third, inflammatory dermatoses. Fourth, fissures and ulcerations. And finally, the scarring. Sweating-related disorders, as this condition in the flexures, erythema, and sweating, which increasing by sweating, can be treated by botulinum toxins, which in this disease is heat and the sweat aggravates the disease and result in worsening of the discomfort and pruritus symptoms. We talk about the heli or familial benign pemphigus. The second is erythematous physicals, usually confined to the hands or the feet, usually some erythema or without erythema, maybe hyperhidrosis in 40 of the patients. This examples on the hand, usually, and can be treated by botulinum toxins. This hydrotic eczema or pomoflex. And this disease has physicals usually under the eye, maybe solitary, maybe multiple, characterizing by chronic course, seasonal variability, and usually exacerbate and increase in warm climates, usually in middle-aged women and centrofacial area. Botox can be used with sufficient treatment. This eccrine hydrocystoma. These others can be asked. The sweat can be in different colors. Yes, however, it is rare condition, but our sweat can be yellow, blue, green, or black, which is called chromohydrosis. And chromohydrosis usually due to apocrine gland because of the presence of the lipofuscin granules. Other disease is bromohydrosis, usually not color but odor can be severe. The disease of erythematous scaly silver scales papules, which is called inverse psoriasis. Usually botulinum toxins can be act as the neuroglandular junction to reduce local sweating, which is subsequent maceration and secondary infection can be decreased. The second category is pain and itching. This disease of herpes zoster after treating can lead to post-herpetic neuralgia or post-herpetic severe pain. Also, Botox can be used in this treatment of this disease. Also, this disease confined itching and eczematized lesions due to sensation of pruritus related to acetylcholine of sensitive C fibers, this lichen Scemblix chronicus. This case of Raynaud's disease, which blood flow can decrease in low oxygens in blood return, which is Raynaud's disease. A local injection of botulinum toxin can improve the perfusion of the injected tissues, opening the vascular bed, inhibition expression of adrenergic receptors. This nice publication of JAD in 2020, first protocol of 14 injections, as we see, the second protocol 18 injections, but in the second no palmar injection. This nice publication done by me, my colleagues, of evaluation of botulinum toxins injection in localized pruritus type. We do the visual analog scales. Done this publication in Journal of Clinical Aesthetic of Dermatology. In case of lichen Scemblix chronicus, the phase before is 9s and 2s and 0. Lichen Scemblix chronicus in the nape of the neck is 8, 2s and 0. Inverse psoriasis in submammary area is 10, then 3, then 0, then 1. Life in balance 8, 3, 1. Also on the thigh. This post-burn itching visual analogy scale is 7, 3, 2. The third disease, inflammatory dermatosis, as this case was caused by apocrine glands, usually in the axilla or the groin, hidradenitis suppurativa. Botox can inhibition of the apocrine secretions and very good results. Also, this disease was called folliculitis decalbans. We found the botulinum toxins inhibit of the immune-related factors. Fissures and ulcerations, usually also chronic anal fissures, are due to hypertonia of the anal sphincter, subsequently can cause ischemia of the arterial circulation and severe pain. Botulinum toxin is well established in the treatment of the anal fissures. Finally, the scarring. We know that botulinum toxins can reduce and soften the scar, particularly in these areas of extensive muscular activity. Botox can be injected either at the time of the scar formation or at the suture formation. This by nice application, we have good sutures after injection of the Botox. Apart from the muscular inhibition, botulinum toxin is thought to inhibit the action of the fibroblast and hence reduce the scar hypertrophy. This another publications by removal of the surgical removal of the scar and injection of botulinum toxin followed by carbon dioxide and have a good results. Others, 20 patients have colloid and hypertrophic scars. One subject is injected by intraregional botulinum toxins type 1 a month for 4 months, and the other part of the scar by subjected to 4 sessions of the carbon dioxide and also at 1 month apart, and then application by topical application of botulinum toxins. This topical injection of botulinum toxins after carbon dioxide, topical application, this interlegional, I have good results, carbon dioxide and topical application of botulinum toxin. This nice publication, botulinum toxins, is dose-dependent effect of re-elasticization and angiogenesis and before and after injection of botulinum toxins. So there is increase in the blood supply, accelerate of the process of the healing, prevent and collapse of peripheral vessels in the cutaneous flap, increase the diameter of arterioles, venules is observed. So in the scar, botulinum toxin injection, decreasing the tension, decrease wound contracture, increase the wound size, decrease the microtrauma, decrease various cytokines release as through tumor growth factors, transforming growth factor beta, decrease also inflammation response, which lead to the following: decreasing the fibroblast and also increase in collagen formations. So I think it is not only cosmetic for the treatment of Botox and the scar, but it's very important to try, everyone can try Botox if at the suture formation or after the suture removal. I would like to thank the EDIF Congress and thank Pan Arab League of Dermatology to be a part of them, and like to see that not now it is virtual and the second year should be inshallah in person. Thank you all. Thank you for listening.
Thank you, Dr. Khalid, for your very interesting lecture about non-cosmetic indications of Botox. At the end of our session, again, on behalf of Pan Arab League of Dermatology, I would like to thank all the participants and all the speakers for their efforts to